Allergies are extremely common and millions of Americans suffer from seasonal and environmental allergies. An allergic reaction occurs when a person's immune system reacts to a normally harmless substance. The source of this substance is called an allergen, and it derives from different foods, pollens, dust, mold, or pets. All allergy testing is completed in one appointment and is relatively painless and tolerable. During your allergy testing appointment, our allergy nurses will utilize the gold standard of testing, the MQT, which is the modified quantitative testing. You should not undergo skin allergy testing if you are pregnant, you have unstable asthma, are on a beta blocker, or are using medicinal marijuana. Before the MQT testing starts, the allergy nurse will ask each patient about their personal medical history and extensive questions in regards to their allergies. The first part of the test is a skin prick test, which takes a total of 20 minutes. During this test, the nurse applies the allergens to the outermost layer of the skin using a skin prick device. The nurse will first start by prepping the skin with alcohol and lets it dry. Next, an applicator is used to apply different allergens to the skin. The plastic applicator has metal prongs on the tip, and pressure in a rocking motion is used to ensure that contact is met on the skin. The sites are then marked with a marking pen, and a box is placed around our positive control, which is histamine. A nurse will then set a timer for 10 minutes. After the 10 minutes, the nurse will come back to the room and assess the skin, especially the positive control that is boxed. If there is no reaction after this initial 10 minutes, we will need to retest the positive control on a different part of the arm. The nurse then will take gauze and get some of the superficial serum off the top layer of the skin and set another alarm for 10 minutes. The nurse will come back after 10 minutes and assess the sites looking for a whealing and flare response. A wheal is a bump on the superficial layer of skin, and a flare is a redness that surrounds the wheal. The nurse will then measure the wheals with a measuring guide and record results. The patient's arms then will be cleaned and Benadryl cream will be applied. Reactions should subside within a few hours, but if they do not, you can apply Benadryl cream, ice, or take an oral antihistamine when you're home. The second part of the test is intradermal dilution testing. This is based off the results of the skin prick test. The nurse will clean and prep the upper arms with alcohol and use a marking pen to mark the sites for the injections. We will then inject a small amount of diluted allergen under the skin with a small needle. An alarm will be set for 10 minutes, and after the 10 minutes, results are to be read, measured, and recorded. The nurse will then discuss results and inform patients what they are allergic to. The nurse will discuss different treatment options and provide detailed brochures and pamphlets on the allergies. The patients will then follow up with one of Coastal ENT's doctors to further discuss their treatment plans.